No, some Americans are wondering if you can safely celebrate the holidays with your family and friends. The answer is yes, you can. If you and those you celebrate with are vaccinated, particularly if you've gotten your booster shot.
Good evening, Black people and all allies fighting for Black liberation, Black prosperity, and Black joy. I'm Charles Blow, and welcome to Prime. Today, President Biden announced his White House initiatives to fight the COVID-19 surge brought on primarily by the Omicron variant. It's been less than a month since South African doctors discovered Omicron, and already the variant accounts for more than 70% of new COVID cases in the U.S. This also comes as Texas doctors have confirmed the first Omicron-related death in the U.S. As part of the initiative, the White House will deliver 500 million free at-home COVID tests during next month. The president also plans to deploy up to 1,000 military personnel staff to assist with vaccinations at short-staffed hospitals.
I'll be deploying hundreds more vaccinators and more sites to help get the booster shots in people's arms. I've ordered FEMA, the Federal Emergency Management Agency, to stand up new pop-up vaccination clinics all across the country where you can get that booster shot.
The government will also add more federal testing sites and increase vaccination access.
We have added 10,000 new vaccination sites on top of the 80,000 sites that we already had in place. And even more will open in January.
While the Biden administration has remained steadfast in its commitment to avoid another federal shutdown, the president, along with healthcare professionals, have reiterated that the American people becoming fully vaccinated is the only way to assure that. Joining us to discuss is Democratic strategist Bre Maxwell and infectious disease physician Dr. Peter Chin Hong. So, Bre, first, I want to just get your take on the president's announcement today.
So, well, I think it's a great step in the right direction. I think the pop-up shops are going to be great, and I also think it's going to be useful in like rural areas. But I also think what we need to also look at is a pathway to make sure that people have access to healthcare. Because at this moment, there are a lot of people who still don't even have access to even get the vaccines. But I agree with him that, yes, if you are vaccinated, you can be with your families. But I also need for the unvaccinated to start trusting science. And I also would like for the vaccinated to go and get the booster shots so that we can work towards a pathway to being able to be outside a whole lot more.
Dr. Chin Hong, from a medical perspective, are 500,000 free at-home tests shipped in January enough? And why are we still in a position of not having enough tests for everyone?
Well, it seems, Charles, that we've been hearing this theme over and over again, not enough testing. In fact, after the president spoke, if you saw, most of the reporters' questions were really directed against testing. So I think you're right, 500,000 sounds like a ton, but our population is 330 million people. And 500 million tests sounds like a lot, but for a population of 330 million people, it will go by really quickly. I'm also concerned about minority populations having access to these tests because they require you to get online. You kind of have to have enough electronic literacy. Speaking for my family, I'm not sure they will be able to do that without my supervision. So I think that's my concern. But the most concern that a lot of people have is timeliness. Like you alluded to, Omicron is here. Omicron is probably going to be down by January. Sure, it may affect some parts of the country, but it may be a sense of too little, too late.
Bre, also the availability of the at-home tests, the Biden administration making them available, seems to be an about-face from the press secretary taking heat for making a joke about providing free tests a few days ago. Do you believe the Biden administration is a bit back on its heels with dealing with the pandemic after having some early success? And there were real successes in the early days.
Yeah, I think so, because if we can mail out stimulus checks to millions of Americans and we can mail out these at-home tests as well, because I was looking at a study today and it says that if you work a minimum wage job and you need to go and get a test done, you're basically losing money and losing hours just to go get a test done. So it makes a whole lot more sense to make sure that we are mailing tests out to families, out to households, so they can test themselves properly at home.
Dr. Chin Hong, Trump has revealed that he not only got vaccinated, but he also got the booster. Biden also mentioned this. One of the tragedies of the pandemic is how politicized the vaccine has become. Do you think that this will help to ease that in any way?
I hope so, Charles, but I'm pessimistic that it will really bring those people really against vaccines into the pro-vaccine fold. In fact, when Trump mentioned that in that rally in Texas, he was booed. And that kind of really illustrates the mood of that population. And you're right, it's been so politicized. But there are people probably on the fence, and we can probably move those people. At the end of the day, you require a lot of conversations with people. There's one study showing that only 17% of people who refuse to get vaccinated had actually spoken to somebody about vaccines. So I think that gives an opportunity as well.
Bre, no one wants another shutdown. It's damaging for the economy, for people's health. It will also be terribly damaging politically for the Biden administration. But can we really rule it out with such low vaccination rates, particularly relative to other wealthy countries, and a virus that is surging right now?
I don't think so. To be honest, a lot of this responsibility doesn't really fall on Biden. It falls on some of these states and some of these governors who never shut down in the first place. If you have been in South Carolina, we've literally been wide open since the COVID virus hit us. So a lot of this responsibility has to fall on the local government and making sure that we are taking care of the citizens in the states. So do I think we can avoid another shutdown at this point? No, but I think we're going to have to take some other precautionary measures like we did before. And I hope we do it soon because I have no desire to relearn the Greek alphabet.
Dr. Chin Hong, Omicron claimed its first U.S. casualty today. It was a person who had been infected before, my understanding. Does this blow a hole in the reasoning of the anti-vaxxers who lean on natural immunity instead of getting vaccines?
Well, in many ways, Charles, I think the first death of Omicron or from Omicron in the US is a metaphor for all of our darkest fears. So first of all, this person was unvaccinated. This person had natural infection before. And again, it just shows that we're not going to be equipped for the people who think that natural infection is going to get them out of the next surge. We have data from South Africa and other places showing that as opposed to other variants, Omicron, you're more likely to be infected with Omicron 5 times more if you've had previous infection. In other words, it's not going to protect you by having previous COVID. The only protection is going to be the vaccine, plus, as Bre pointed out, extras like the masking, like the political will in the community. That's going to get you out, and not just regular vaccines.
Bre, as the doctor mentioned before, access is still going to be an issue, particularly for low-income people. Very, very often that overlaps with racial and ethnic minorities. Why is the White House not just making that access far more easy? Why is it not sending it out to drugstores? They will be in people's neighborhoods. Why they're not, send them out to, I don't know, barbershops and beauty salons that would be in people's neighborhood, that people would have easy access to get them, check them out, put their name somewhere, report that back to somebody, but to get that out into people's hands and not have them waiting by a post office box, or not have them trying to sign on and fill out a form online to get tested?
Well, I think a lot of that also comes to personal responsibility. A lot of these barbershops and beauty salons have to also want these things in their areas. I do know that they have did some tours here. Like I said, I keep going back to South Carolina and what they've done here, but I do know they have done some tours and some town halls and some discussions on these issues here and how we can have better access to it. Another thing they need to do is making sure that every student, every school has access to a mask. It breaks my heart when I drop my son off at school and there are kids walking around without masks on. So those things are deadly to people, and just watching people walking around still without masks, I think access to having proper masks is another important factor that we need to have. So yes, we need to have them in beauty salons and barbershops. We should have all these things in restaurants. When you walk in, take a COVID test before you can even come into this restaurant. It shouldn't be a situation of, well, if you're vaccinated, then you can come in, because there are going to be people who will lie about a vaccine.
Dr. Chin Hong, it's kind of winding down our time here, but the president made a point of saying this year's not last year, right? That if you are vaccinated and you have around a lot of vaccinated people, you can feel free to celebrate your holiday as you were planning to do so. You know, we have so many breakthrough infections at this point. Is it still wise advice to tell people that they can go ahead and celebrate the way that they want to, not cut back like they did last year?
I don't think so at this point, Charles. I think that, one of the ways in which the Biden administration was critiqued, even though they did a lot of good by having this national plan and distribution, the way they were critiqued is by putting all the eggs in the vaccine basket. And as Bre pointed out eloquently, you can't do that only with Omicron. So with a family gathering, with a Christmas party, if you introduce rapid testing on top of the vaccines, I think that can make it a much safer gathering. In fact, that's the only gathering I personally would go to at this point with Omicron surging.
Right. Yeah, my kids are coming for the holidays if they make it, and I tried to get at-home tests today. They're all sold out. Even if you try to do this the right way, the way they're saying doing it, you can't do it. Like, there's no way to get the at-home test to have them test before they come through the door. Anyway, Dr. Chin Hong and Bre Maxwell, thank you both for joining us tonight. Really great conversation. I appreciate your time.